Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started. Hi, I am Ashley, and we are recording live at the Chiropractic and Legal Injury Conference for the Chiropractic and Legal Injury Podcast. And we are so excited to be here. It's a beautiful day in Scottsdale. We're at venue 8600, and we have a very special guest, which we're really excited to get into. So let's jump in. Tell us a little bit about yourself.
Hi, thank you. Thanks for having me. My name is Dr. Radi. I'm president, co-founder of Backfoot Health and Spine. We've been serving the Valley since 2002, and we are an integrated multi-specialty group practice. So we focus on really taking a very comprehensive approach to what the patient needs and have a lot of resources under our roof and knowledge in our database of providers to see what the patient needs to get them back to the health that they deserve to be at.
Yeah. Whatever stage that is.
Yeah,
right?
whatever that is. Yep.
Yeah. So for that, kind of integrated thing, what kind of unique aspect does that provide for personal injury patients specifically? Well,
specifically for personal injury, it really allows them to come to one facility and not have to bounce around to different facilities to get different things done. Yeah. We know that after a traumatic experience like that, time is always a constraint. Sometimes transportation's a constraint, and just the unknown. There's just a lot of unknowns. Nobody plans to be in an accident, right? No. So there's a lot of the unknowns, and we feel that when they come to a facility that does so much under one roof, it really eases their anxiety that already exists, and they're grateful. They don't need to bounce around and go drive around town to different things. Of course, we provide transportation, if they do need to get to us and they can't. So giving them that ease, and I think that's the most important thing when these people come in after these types of situation is providing some real genuine ease of knowing that you're in the right place, we're going to take care of you, and if there's things that we feel you need to have done or things that you need that we don't provide you, we're not going to just tell you, go find somebody that does this. We will literally drive them to wherever that is or get them that resource so they can feel comfortable, confident that they're in the right place. And because it's super stressful for people, as you know.
Absolutely.
So,
we were just talking about that a little bit earlier, just kind of any sort of hindrance and making things harder to do, people are resistant. Yeah. And on top of that, all of the adrenaline and the stress and the added things that they have to juggle when they're in a personal injury case about their car and how do they get to work and do they have to work, and all of those things become greater hindrances that makes them less likely to really take care of themselves, which is what they need. So I love that, providing it all and the concierge of getting them to where they need to go as well.
Yeah, and especially it's not only them. Let's just imagine a mother or father who are caring for kids, right? Yeah. And maybe the kids were in the accident, hopefully they're not. And if they are hurting either physically or emotionally, and yet they got to take care of their kids and drive their kids to sporting events and to school, and they're not feeling well, whatever ease we can give them so they can continue being, a mom or dad or whatever that is, that's a huge factor. So as a matter of fact, you asked me a question earlier and I just thought of something. We had one of our team members a week ago or so, a lady didn't know how to set up the online shopping. She's like, I don't have time to go to the grocery store. I can barely get in the car. And our team member sat with her for an hour and literally built her Fry shopping cart. So she now knew how to order food, which she'd never done before. I don't even know how to do that, but set up her cart to know, okay, now I can order food, so Fry's will bring it to me. So it's just the little things like that,
They make
you just
all
don't
of the
think
difference.
about.
Yeah, for us as well, working at the Lazzara Law Firm, the little things are what make all of the difference. And people may not notice it, everything, but they really do. Oh. And being a mom, exactly what you said, that anxiety of, making sure my son gets to school and that he has his lunch and all of these things, being able to lower that anxiety is huge.
Yeah, and I think it's part of the healing process. When some of that burden and that stress is removed from you, I think you heal faster.
That's a great point.
You know what I mean? So,
absolutely. Yeah. I love the integrated approach, and this conference is big on talking about collaboration because collaboration really transforms care and it makes it better. And how does your office really work with that concept and make it work for the patient?
Yeah, that's a great question, and I could not agree more. That is been one of our pillars for so long, obviously since we started. So I don't know anything but collaboration. And for us, I just feel that there's so many things that a patient comes in with after an auto injury or any type of injury. And it's our responsibility to really determine what are those things and what are the things that we can help them with. Certainly if it's something that we can control and take care of, we know the care is going to be effective because it's going to be immediate. Whether it's getting them over to our pain management doctors, or whether it's to get them over to PT, or whether it's to get them over to, getting imaging done, or whatever that is. It's just providing convenience. And collaboration also, as a provider, really allows those providers to communicate. Half the times when people come to a practice and then they're referred to an ortho across town or a neuro across town, those doctors are not talking to each other. They're too busy. But in our group, our doctors case manage weekly on every single case. So they're talking about what's going on with this person, how are you doing with them. Pain will say, hey, we're doing good. We think they might need one more series of injections. And the chiro might say, yeah, we think we'll be done in about a week or two. So there's constant talking and collaboration about that patient. And they like and appreciate the fact that doctors are meeting on their case, because cases are often very complicated, you know, so let's not make it complicated more and try to simplify it. So I think the integration and collaboration is one piece, but the communication amongst providers is another integral part.
Absolutely. So. I know, as being a patient, not in a car accident, knock on wood, but as being a patient just in general, when I go to a doctor's office, and it's my doctor's office, and somebody else sees me, but they didn't talk to each other about me, and then you have to say your whole story again, especially if it's a traumatic experience, just reliving it over and over.
You don't want to do that again. No one wants to do that.
And every single doctor that you go to, like every single stage you go to a new doctor, you have to say it all over again and relive it all over again. And if it's traumatic, it's hard. But having that communication that they almost don't have to do that all over again, because, that communication really alleviates that for them.
I think it's a game changer for people.
It really is.
Yeah, it eases that tension for sure. So
that's amazing.
Yeah.
So I could probably guess, but what would you say is the most rewarding part of your job?
Well, as a provider, I haven't practiced in several years. As a provider, the most rewarding part was obviously the outcomes, naturally. Yeah. You know what I mean? I mean, that's just speaks for itself, In the role that I'm in now, in more of an administrative role, is just hearing what our doctors are doing, listening and watching cases managed the way they should be managed, and knowing that we contributed to that. And even though I don't have direct contact with patients any longer, unfortunately, just leading our doctors and motivating them and just keeping them engaged with what our premise is and what our pillars are. And so that's, and if I ever have the privilege of hearing like that lady. I love hearing those stories because I don't get to hear those as often as I used to, so that makes everything that we do well worth it.
Absolutely. So, definitely make the hard days worth it, right?
Absolutely. Yeah.
The ones where just so many things are going on, I mean, even in the practice. And I know for us as well at the law firm that hearing the case close and the relief that that it's over and they're healed and they can get back to their life is just... that definitely makes it worth it. It makes you want to do that for so many more people.
Yeah, because I think a lot of people don't get to experience that. They have a bad taste. And, we'll get patients that will come in. And I remember this when I was in practice, a patient would come in and say, I had a really bad experience with the previous doctor or the previous attorney. And, of course, we have to do some damage control. Even though it wasn't us, we're like, everything's going to be better here. Yes. We got you. But it's out there, and I hope that conferences like this and this type of collaboration and these platforms will allow doctors to kind of, take a new leaf and turn a new leaf and collaborate more, and I just think that's when people win, so.
I think collaborate more and just that continued education, right?
Yes.
There's always new things to learn and new things to improve, and just being able to get together and talk about it and how do we make this better for the patients and our clients, and how do we improve this and how do we work together more seamlessly, like just kind of that big hope that we can do more and impact more and help people. Because as we were saying, there's like 300 cases or 300 accidents in Arizona a day, and that's just reported, right?
Yeah.
And there was another crazy statistic, I could be wrong, so don't quote me, but it was like people who get in a car accident are 70% more likely to get into another car accident.
And we see that all the time. All the time.
It's so crazy.
We're like, you need to work from home. Don't drive anywhere. It's like, you feel bad for them, right? They're just getting back to on their feet with stuff, and then gosh forbid they just
absolutely.
I don't know what that is, so
we had a client go to her chiropractor for her very last appointment. To sign off on everything, and she got hit again.
I have heard that more than once.
So
We've had that
crazy.
happen so many times. It's just crazy. Yeah.
Do you have a lot of people that for that second accident they come back because of that integrated care and that?
Oh, absolutely.
Ease?
Because we don't just do personal injury. We do primary care. We do conservative care. We take health insurance and Medicare and all that stuff. Personal injury was not always the only thing we've done. It was typically about 15 to 20% of our practice up until about 5-6 years ago.
Okay.
So yes, we do see a lot of people, and we do have a lot of patients that retain us for primary care after the fact, or for wellness checks, or they want to come in for chiro or IV or allergy testing or whatever we do. But yes, we do have a lot of patients that thankfully had a great experience with us. And whatever attorney they worked with, whether we referred them or vice versa, and they will come back to us for that.
And when we're talking about IV, we're talking about I'm gonna mess up the name, but like the immune boosting. I have to tell you, shout out to that, because I had the flu from my son, I don't know, last year or something like that, and that was the single most influential. It changed in minutes. You can feel your body just breathe again, and it's that extra boost to help your immune system, because you're dehydrated and you're tired and you're fatigued and all these things, and those things are miracles. They're
great, certainly great for immune support when people are sick. But if we bring it back to the personal injury case, we use it with that as well, because they're dehydrated, muscles are sore, most people are dehydrated, right? So we know that if we can hydrate the muscle, and we live in Arizona, if we can hydrate them, they're going to heal faster. And if there's pain, we can infuse some pain medicine, or if there's nausea, we can put some nausea medicine so they feel better. So that is part of our integrated care.
That's a great thing. Oh my gosh.
And they love it.
Absolutely. I'm all about that. I haven't experienced it in an accident yet, knock on wood again. But yeah, that's incredible.
Definitely good. Yeah.
Awesome. So is there a piece of advice that you would just give for anybody who ever got in a car accident in Arizona? Something that they should know?
I would say the first thing is to get evaluated immediately. Most patients will walk away from an accident and they'll say, I'm fine. The adrenaline, the natural killers, painkillers are kind of kicking in, the adrenaline. Within the first couple of days, after the first couple of days, I should say, then they're like, oh my gosh, why does my neck hurt so bad? Or why does my elbow hurt? So the sooner they get in to get evaluated, we hope they're fine too.
Right.
But we also know that things will come on days, sometimes weeks after the shock level has kind of subsided a little bit. So I can't stress the importance of that. I have friends and family and neighbors and who will text me periodically, and they're like, I just got rear-ended. I might get in the office right now. Like, get in immediately, and let's start taking care of you. Because if we can get them under care sooner than later, we're going to minimize things kind of getting out of control, so.
And just having that knowledge, right? Because the adrenaline covers everything, and you're not even realizing that you may be hurt. And with that, we always recommend getting, seen before you talk about any sort of settlement with your insurance company or anything like that, because you have to know that there's something going on, and the adrenaline will ease down, and you want to make sure that you're aware of those things.
Yeah, absolutely. I think that unfortunately people put their car and their property damage over their health.
Yes.
So they're more worried about how am I getting to work, and that's part of what I mentioned earlier. Is if we can ease their concern of, we'll get you an Uber, we'll get you here to your appointments. Don't worry. If you don't have rental car coverage, we'll work with you. We'll figure a way to get you to get your kids to school or get you to work or whatever that is, because they're just thinking about what about this, what about that. So and the last thing on that list is typically their health, right? Themselves, right? So. So we try to do what we can to help these people. We certainly can't do everything, but we will at least guide them and not just assume that they're going to take control of it themselves, because most of the times they just don't know. Nobody's prepared for that, you know. So
that's why they call it an accident.
Exactly. Exactly. Yeah.
I feel like that with that getting seen immediately, we were talking a little bit earlier too, even if that initial thing you're seen immediately, right? And they say you're okay, but then you start to not feel okay, go back.
Absolutely.
Go back. Or to a different provider maybe, but definitely make sure that you are taking care of yourself, because you can't do all of the things. You can't take your kid to school. You can't do all the things if you are not making sure you are healthy.
Yeah, all their responsibilities, and of course, a large demographic of our patients that are in like manual labor, or they don't happen to work behind a computer. Even the ones that work remotely or work from home or work behind a computer, those activities of daily living become much more difficult, and it's important to just get evaluated. But that would be my biggest piece of advice, so.
That's awesome.
Yeah.
Okay.
Yeah.
So I have time for one more question.
Yeah.
What's something about yourself that maybe people don't know? A hobby or how you relax?
How much time do you have?
Is it a long list?
No. Something about myself. Oh my gosh. Well, I will tell you an interesting fun fact, or a silly fact is, unfortunately, a few years ago, we were in the pandemic, and we all lived a different lifestyle, and a lot of businesses were closed and whatnot. So my gym closed down, obviously, like most gyms closed down. And then the owners of my gym decided that they're not going to reopen it. So me and another member decided, what a great time to buy a gym. So we bought a gym during the pandemic when gyms were closed.
Okay.
So, fun fact, right?
You own a gym.
Yeah, we still own a gym. Yeah, we still own a gym, and it was because of the pandemic. And if it wasn't because of the pandemic, I wouldn't have bought the gym. And it's kind of fun. It's a hobby. Obviously, we're a very active family, and it's a fun thing for us to do. So.
Do you still work out in your gym?
Oh yeah, absolutely. Yeah.
It's not like one of
the
those.
most expensive gym membership. Yeah, I have to go work out there.
I feel like it's one of those things where, people are like, oh, I'm going to get a home gym.
Yeah.
And they do a home gym, and then they never work out in their home gym.
They don't. Yeah, they don't. So.
But you still work out there.
Yes.
Oh, that's awesome.
Yes.
Well, awesome.
So.
Thank you so much for all of the information, for being on here. We so appreciate it. And thank you for coming to the conference. And hopefully we will see you next year.
Yes, thank you for having me.
All right. Thank you.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this episode with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.